Hello everyone, welcome to Spine Focus. Are you someone who's struggling to sit even for a few minutes because of pain at the tailbone or the coccyx? You're not alone. This is a very common problem which is often misdiagnosed or underdiagnosed. Today, let's talk about coccydynia, how we diagnose it, and the management options. Coccyx is made up of 3 or 4 small pieces of bone right at the bottom of your spine. Because of its location, the pain here can interfere with your daily activities and often making your life miserable. Coccydynia often develops after a fall onto your buttocks. Some women can have coccydynia after childbirth, and in the vast majority of patients, there is no clear reason as to why this develops. The problem is because of inflammation at the sacrococcygeal joint, and sometimes because of abnormal mobility of the coccyx. The good news is that most of the patients get better with simple measures and with time. We recommend using a ring cushion or a Coccyx cushion whenever the patient sits to offload the coccyx. We also recommend using analgesic gels or over-the-counter pain medications for a few days. Sitz bath, which is basically sitting in lukewarm saline water during the morning and in the evening, can be helpful to relieve the inflammation and to reduce the spasm. Once the pain improves, we recommend that the patient start with specific exercises, namely pelvic floor strengthening exercises. I have included a link to these exercises in the description box below. If your pain continues to persist despite these simple measures, you need to visit your nearby spine specialist. He will examine you, order the imaging, probably an MRI scan, to make sure that there is nothing significant affecting your spine or the surrounding structures. The next option for management of pain would be a procedure called manipulation under anesthesia. This is a simple procedure which is done under sedation, where the spinal surgeon or the specialist would manipulate the coccyx, and this is followed by a steroid injection into the sacrococcygeal joint, which is done under X-ray guidance. This procedure can be done as a daycare procedure. Majority of the patients would have good pain relief after this procedure. In very rare circumstances, patients may continue to have extreme pain despite all these measures. Then the last resort would be to subject them to a procedure called coccygectomy, which is basically a surgery to remove your coccyx. So remember, tailbone pain can be very debilitating, but most of the patients get better with simple conservative measures.